Hey Nurse Fam! In your practice, have you met patients who fear gaining weight despite being dangerously underweight, or patients silently battling cycles of binging and purging? Today we're talking about two serious mental health disorders with life-threatening medical complications: anorexia nervosa and bulimia nervosa. Let's dive into how to identify them, treat them, and most importantly, support them with skill and empathy.
Both anorexia nervosa and bulimia nervosa are psychiatric conditions listed in the DSM-5, often affecting adolescents and young adults, but can occur at any age. For anorexia nervosa, we see a restriction of energy intake leading to significantly low body weight, an intense fear of gaining weight or becoming fat, and a distorted body image or denial of the seriousness of low weight. Now, for bulimia nervosa, the criteria include recurrent binge-eating episodes with a loss of control over eating, compensatory behaviors such as vomiting, laxatives, or excessive exercise, and the binge-purge cycle occurring at least once a week for 3 months. Additionally, self-worth is overly tied to body shape or weight. These disorders are rooted in complex psychological, social, and biological factors and require long-term, multidisciplinary treatment. Let's talk about the medical complications to watch for. In anorexia nervosa, severe electrolyte imbalances like hypokalemia and hyponatremia, bradycardia, hypertension, arrhythmias, osteopenia, amenorrhea, cold intolerance, lanugo hair, delayed gastric emptying, and the risk of refeeding syndrome during treatment are all critical concerns. For bulimia nervosa, watch for metabolic alkalosis from vomiting, parotid gland swelling, dental enamel erosion, esophagitis, gastrointestinal bleeding, Mallory-Weiss tears, cardiac arrhythmias from electrolyte shifts, laxative dependence, and rectal prolapse. Assessment and monitoring are crucial in managing eating disorders. Labs should include electrolytes like potassium, sodium, and magnesium, as well as renal function, glucose, and phosphate levels. An ECG is necessary to monitor the QT interval for arrhythmia risk. Keep an eye on weight trends, vitals, and intake and output. Additionally, screen for coexisting mental health conditions, such as depression, anxiety, and obsessive-compulsive disorder.
Nutritional rehabilitation is key. Start with gradual refeeding while closely monitoring electrolytes. Be vigilant for signs of refeeding syndrome such as edema, hypophosphatemia, and arrhythmias. Collaborate with dietitians to create individualized meal plans. Medical monitoring involves daily weights taken at the same time and in the same clothing. Keep track of labs, vital signs, and physical symptoms. Monitor purging behaviors discreetly and respectfully. Psychosocial support is equally important. Build rapport without judgment and support body image healing. Work closely with therapists, psychiatrists, and social workers. Patient education and advocacy are also crucial. Normalize food as medicine and encourage realistic, non-punitive thinking. Educate families about the illness and the recovery process. Eating disorders don't just affect the body, they overwhelm the mind and spirit. As nurses, you are essential in early detection, restoring health, and being a steady, compassionate voice through one of the hardest battles a patient may face. Share your thoughts, tips, or experiences in the comments. Let's break the stigma together. Like, subscribe and follow for more content on psychiatric medical care, bridging body and mind through evidence-based nursing.
And remember, restore health, build trust, empower recovery.